Good morning and welcome. My name is John Houselot, President of the Minnesota Trucking Association and a member of the steering committee for Minnesotans Against Marijuana Legalization. Joining me today in the news conference are three other members of our steering committee. Paul Austin, President of the Minnesota Safety Council, Ryan Hamilton, who is a Government Relations Associate with the Minnesota Catholic Conference, and Kim Bemis, who is Chair, Smart Approaches to Marijuana Minnesota. We will be taking questions following the four presenters, so please note your question and your media outlet affiliation in the chat, and you will have the opportunity to ask your question at the end. And I see a hand up there. Oh, that's my hand covering things. Very good. So again, we'll take questions at the end after all four speakers are done. The legislature's prime responsibility when it enacts a law is to make sure that it is both safe and its benefit outweighs its cost. Minnesotans Against Marijuana Legalization believes that the recreational use of marijuana makes Minnesota less safe. In a perfect world, our coalition would roll back last year's THC hemp-derived law, but with the recent election, the odds of rollback are not high, not likely. So we must, and this is at a minimum, fix the deficiencies in last year's THC bill. Now, despite what the proponents might say, full legalization of recreational marijuana this session is far from a slam dunk, especially when legislators thoughtfully consider all of the very real public safety and societal risks and costs that it will create. Now, Minnesotans Against Marijuana Legalization intends to keep legislators accountable by utilizing a six-factor scorecard. And we can bring the scorecard up right now. We intend to use a six-factor scorecard. Any bill that does not adequately address traffic safety, public safety, regulated industry, social and community impacts, workplace safety, and public safety should not be passed into law. And I think it's important to stress that these factors will only reduce impacts. They will not eliminate them. And as truckers, we are especially concerned about traffic safety. We can bring this down. I'll drop the scorecard there. Thank you. As truckers, we are especially concerned about traffic safety. Legalizing recreational marijuana will unleash more impaired drivers on Minnesota roadways and upon an already understaffed law enforcement contingent without a reliable roadside test to determine levels of impairment. I just want to say that again. We are going to unleash more impaired drivers on Minnesota roadways on an already understaffed law enforcement contingent without a reliable roadside test to determine levels of impairment. Paul Austin of the Minnesota Safety Council will address workplace safety, public investment, and regulated industries. Go ahead, Paul.
Thanks, John. To carry on this conversation about the elements that need to be addressed in responsible marijuana legislation, under public safety, there's more than just traffic safety to public safety. Inside the Department of Public Safety currently, there's a division designed specifically to manage and help manage alcohol and gambling. We need to ask ourselves, do we need a similar division, or do we need to add to that division to work in concert with regulations and other parts of regulatory bodies that regulate industry for marijuana? We also know that in the public safety realm, when the legal market increases, so does the illegal market. And so there's a whole range of activities that will need to take place in the public safety arena to deal with the illegal market. And then under the header of public safety, we need to separate our desire to maintain safety, to improve justice, and separate that from the criminality issue around marijuana or other impairing substances for that matter. There's a need to deal with safety on the road separate from, is that driver a criminal? There's a need to do the same thing in society. There's a need to do the same thing in the workplace. As far as regulated industry goes, an infrastructure needs to be built to manage this new industry, just like there is for alcohol. And this means you have to establish clear regulatory authority and the resources to manage that authority. You also need to think through things like packaging and limitations on the purchases of the substance and who can have possession of the substance. The current law doesn't do that at all, and the discussion that we've seen over the past few years doesn't really address either of these. We've seen some bad examples of packaging in this state already with the edible gummies. Under workplace safety, just like there's a concern for John and his professional truckers on the road in their workplace, that same workplace safety concern exists with impaired employees in the workplace. Some other states have actually barred employers from taking action or working through issues with impairment with marijuana. We want to make sure that if legislation is passed in this state, employers have the right to set zero tolerance policies for safety sensitive positions, that they understand their liabilities as they act within state and federal regulations, and that the support and understanding of impairment is extended not just in the public realm, but into the workplace as well. And lastly, on public investment, all this takes money. It all takes time and resources to make this all happen. Currently in Colorado, they're spending $4 public dollars for every public dollar they collect in taxes. We need to have a robust public policy debate about the wisdom of collecting a dollar while we're spending $4 and what we would have spent that other $3 on in the meantime. Similarly, if we say, fine, let's make marijuana pay for itself, then we have to take a look back to the public safety side and ask, well, what does that do to the illegal market? And it starts this circuit all over again. So that chain of activities needs to all be completed if we're going to do this as responsibly as we can. John, I think you're still muted.
Thank you very much. And now Ron Hamilton of the Minnesota Catholic Conference will address social and community impact.
Thanks, John. Minnesota is not ready for legalized cannabis. No state has been ready for legalized cannabis. The legalization of recreational marijuana has proven itself to be a failed, industry-driven experiment that offers zero benefit to the common good. According to a Gallup study, only 12 to 13% of the population regularly partakes in recreational marijuana. Much of the support for legalization is really based on a lack of information or blatant misinformation. Thus far, the issue has been dominated by one-sided messaging driven by those who believe they can benefit financially or politically from the commercialization of THC. This form of legalization reduces individuals and communities into profit centers for a predatory industry that feeds on addiction. Any change to Minnesota's cannabis policies will impact every Minnesotan's quality of life, rich or poor, young or old, users and non-users. This scorecard will ensure that families, disadvantaged communities, and vulnerable populations get the consideration they deserve in this policy debate. As we've seen from other states that have opened their door to the marijuana industry, the promises made to justify legalization don't come true. Let's look at Virginia. In the year after legalization, Black adults accounted for nearly 60% of the marijuana cases in state courts, despite Black people accounting for only 20% of that state's population. We have seen similar unkept promises from other states that have legalized. Yet proponents continue to portray marijuana legalization as a vehicle to correct social injustice and create social equity. When it comes to marijuana, we must be careful not to injure justice under the guise of promoting it. Marijuana legalization delays justice by tying expungements, financial investment, and other reforms to the approval of a drug industry. It is unjust to put such a price on justice. Social justice requires that all actors, businesses, families, and the government embrace certain responsibilities towards each other. This scorecard will ensure that any cannabis legislation is held accountable to those responsibilities. Thank you.
Thank you, Ryan. And now Kim Bemis of Smart Approaches to Marijuana Minnesota will address health impacts.
Thank you, John. Yes, my name is Kim Beavis. I'm co-chair of Smart Approaches to Marijuana Minnesota. And while my group continues to oppose the commercialization of cannabis, we heartily endorse this scorecard and the efforts to be sure that any cannabis legislation provides for the safety of the citizens of Minnesota. So I'd like to speak on behalf of the health and safety issues, especially the current potency effects on adolescents, and the black market. There have been several studies just in the last year that I would like to highlight about the health and safety issues related to cannabis use. Two of these studies, one from New Zealand and one from the Great Smoky Mountains, followed over 1,000 individuals for over 25 years. Both studies found similar results, with regular cannabis users averaging a decline in IQ, worse performance on learning, memory, and information processing tasks. But the problem with these studies is that they were based on cannabis that was at best 3 to 5% THC. And I use cannabis as opposed to marijuana really to highlight the thing that gets you high. Okay. We are extremely concerned about the current potency level of what is commercially available and how that may affect users. What is commercially available today in stores in commercialized states is the flower anywhere between 20 to 25% THC and vape cartridges between 70 to 90% THC. A study that was published in the British journal Lancet in September was a longitudinal study of over 200,000 individuals. Their conclusion was that high potency cannabis correlates to increases in psychosis and cannabis use disorder. But for these and most studies, high potency has been anything over just 15% THC. One of our major concerns is the effect that high potency cannabis is having on adolescents. A slide from the Minnesota Department of Health showed that in 2021, 72% of adolescent admits for treatment had cannabis use disorder as part of their diagnosis. From a study that was published in the journal Addiction in August, there was a rigorous comparison of cannabis use among youth and adults in legal states and non-legal states. The results showed that in legal states, there was a greater likelihood of transition from non-users to users in comparison with non-legalization states. And last, I've heard the governor say that with commercialization, cannabis customers will now be able to know what they're purchasing. This is one of the biggest myths about cannabis commercialization. The idea that by commercializing cannabis, we are going to get rid of cartels in the black market has not yet occurred in any state. A couple of years ago, the governor of Oregon estimated that the illegal market was 7 times the legal market, and in California it's been estimated at 3 to 1. The Board of Pharmacy was completely overwhelmed with the recent edibles legislation, and this needs to change. The only way to counteract this is by robust inspection and enforcement. So we support the scorecard and hope that any bill that comes out provides ample support for treatment, education and prevention, and robust enforcement and inspection. Thank you, John.
Thank you, Kim. So one of the things we want to do is show how the scorecard might play out in real life. So Lauren, if you could bring up, this is last year's THC bill, House File 4065, and Paul's going to walk you through how that bill would have scored using this measure. Go ahead, Paul.
Absolutely. Thank you, John. So in terms of traffic safety, last year's bill did not mention traffic safety at all or address it in any fashion. So we would score it an F in all those areas. For public safety, similarly, there was not any mention directly about public safety or indirectly about some of the systems that could be and should be put in place to manage marijuana. So that element would receive an F. There was an effort to identify the Board of Pharmacy as the regulatory entity. They had already had some activity in this area, so that made sense, but there was not a set of limitations that made sense on packaging. There was not a set, there was some limitations around ages, but the age of possession was not addressed at all. And as Kim said, you need a significant regulatory enforcement structure to manage this. And we do know that the Board of Pharmacy did not receive extra funding or authority to manage this, and we're overwhelmed when this law went into place. So recognition that it's needed gets it a D, but activity beyond that, it wasn't evident. And if you look at social and community impacts, workplace safety issues, and the public investment debate, none of those things occurred in this bill as it was signed into law. So it would receive an F on all those functions and elements. Overall, have to give it an F. We understand the intent, we understand the goal, but the debate wasn't sufficient to get us to a place where it would score better than that. Thank you, John.
We're going to move to questions. We're going to move to questions, but I would just like to say in conclusion, there is a myth out there that says that this is a done deal and that this bill will pass this session. We disagree. We think if legislators use this scorecard and thoughtfully consider the factors, they're going to see the many barriers and challenges that any bill will pose. And we want to stress the fact that even if all the factors are addressed, they will only reduce impacts, they will not eliminate them. The legislature's prime responsibility is to make sure that it passes laws that are safe and that the benefits outweigh the costs. And as you can see from last year's bill, it didn't pass that muster. So I will also just add in conclusion that there's this additional myth that all of these factors happen in isolation, that marijuana is never taken with alcohol, that it is always taken at the exact amount that it is sold at, that they never get in a car when they're using it, that it is only adults who have access to it and it never gets used by kids. The reality is we live in the gray, all of these things happen. And so legislators have to very carefully consider any bill and those multiple impacts. With that, I see we have some questions in the chat. And if you want to, you can ask your question, unmute. Lauren, can we make sure we have everybody unmuted, and we'll start with Pete Callaghan. Go ahead first from InPost, Peter.
Hi, thank you. So you guys were able to grade the hemp bill, but did you know about it beforehand? Did you have the opportunity to lobby against it, testify against it, know what was there before July 1 when it took effect?
Ryan, you want to cover that?
No, we had no idea that it was in there. It was, as Winkler and Hansen said in a Politico article, kind of snuck through. They didn't talk about it to any of their Democratic colleagues. And it was, while there were several pages on CBD edibles and packaging, there was just one sentence that included 5 milligrams of THC or 50 milligrams per package. So we had no debate, there was no discussion, and we were as surprised as others when this was passed.
This is Paul Austin from the Minnesota Safety Council. I think the fact that you're even asking the question underscores the lack of public policy debate around the issue in total. So we were taken by surprise by it. We own part of that. You know, it's part of our job to manage and monitor. However, I don't believe the factors that we're laying on the table today as reasonable scoring elements were debated sufficiently at all with the bill that was signed into law. And I would argue that the last 2 or 3 years of legislative discussion around this topic have failed to cover that ground sufficiently.
Peter, do you have a follow-up, or is that good?
I do not, thank you.
Okay, Bill Werner, go ahead, Bill.
Yeah, hi, John. Thank you. And thanks, panelists. I guess the general question, everybody can hear me okay, I take it? Okay, we're good? Okay. The general question is here, you've got some major players, Governor of Minnesota, Speaker of the House of Representatives, that are backing this. How do you get past that?
Well, I'll jump in and say, we appreciate the governor said, let's have the discussion. And he said, let's look at it. I don't think the governor ever said it's a done deal and it's going to pass. He said it's time to have that debate. So we're going to take him up on that word and have that thoughtful debate. And I think, frankly, every legislator that we've talked to, and we talked to many in the interim since the election, they all have concerns. They have huge public safety concerns. So while publicly they're saying this has momentum and their election results that they have to respond to, I think these are thoughtful people. These legislators care about the people of Minnesota. And I think when they look at it holistically, they're going to be able to take a deeper look than perhaps they've had in the past. And I don't think this is on a fast train at all.
Just one follow-up, if I may, and this is a sensitive area, but is one thing that a lot of the proponents of it mention is the unequal prosecution that falls more heavily on communities of color, and they are using that as one piece of their rationale for legalizing this. Any of you care to respond to that?
Yeah, I'll take that one. Communities of color, they deserve safe roads, safe communities, drug-free environments that will allow them to raise their kids and allow their children to thrive. They deserve that too, in addition to criminal justice. So if this is really about racial justice, then the legislature should consider pivoting their focus to a decriminalization effort that is not contingent upon the full commercialization of THC. So we have to get our terms right. Decriminalization, legalization, it means different things to different people. There's a case to be made for decriminalization as a standalone measure that will resolve the racial justice concerns.
Thank you very much. Appreciate it.
So I do not see any other questions in the chat. So if you want to ask a question, please note in there. We want to make sure we cover everyone. I will say in the media advisory, you received the scorecard, and we will have it up on our website, Minnesotans Against Marijuana Legalization. And that website, as the session progresses, you'll see more information we have on all of these various impacts and effects. So we want to thank you for taking the time to participate in today's news conference. And we look forward to talking with you more as the session progresses on this important issue. Thank you, everyone.